Okay, so let us move to the second presentation. It will be by Najmul Haider. So Dr. Najmul Haider is an epidemiologist and public health researcher working as a lecturer of epidemiology at Keele University. And Dr. Haider works as a postdoc in PANDORA-network between 2019 and 2022. And Najmul implemented a large One Health project on the Lassa fever virus in Sierra Leone, and also work with us in Brazzaville on Chikungunya virus. So Najmul, we are very pleased to listen to you now.
Hi, Francine. Thank you and very welcome you all to the presentation. So let me share my screen. Do you see my
Yes.
slide? Is it
Yes.
in presentation mode?
Yes, it is.
Okay. Thank you. I'll be discussing on the risk factor, especially the modifiable risk factor for Lassa fever infection in Sierra Leone. I think you already got some background on Lassa fever from Isabella, so I'll skip those. But Lassa fever is listed as a WHO's R&D blueprint disease list and also in the list of CPHIA's priority vaccine list. So this is a very important virus recognized by the bodies. There was an estimation in 1980s published by Dr. McCormick, shows that there are about 100,000 to 300,000 cases annually and 5,000 to 10,000 deaths. But the recent estimation shows that nearly 1 million cases in West Africa. Geographically, Lassa fever is endemic in West Africa. Frequently, outbreaks are reported from Sierra Leone, Nigeria, Guinea, Liberia, and Ghana. Sporadic cases reported from Togo, Benin, Cote d'Ivoire, and Mali. The primary reservoir, as Isabella mentioned, Mistomys nathanensis, which remain healthy with the virus, and actually is distributed across entire sub-Saharan Africa. So it's a question from the very beginning, and it still remains as a question why we see a lot of Lassa fever cases in West Africa, not other parts of the sub-Saharan Africa. Lassa fever also detected from some other species, especially from Mistomys erythrococcus and Hylomiscus pumpi. The role of domestic animals is not known, whether they are infected with Lassa fever and whether they can play a role in transmitting Lassa fever virus to human. So we don't know yet. So one of the initiative was taken by PANDORA-ID-NET. I think you have seen the presentation from Isabella that shows that we are testing dogs and cats whether they got the infection and are important for maintaining the transmission cycles. In general, it's still rodent to human transmission is the primary route of transmission. That is the spillover one. And then human to human transmission is around 20% of the cases. Most of the cases, around 80%, are asymptomatic. Severe clinical sign is hemorrhage from liver, spleen, kidneys, and respiratory distress. So the overall case fatality rate of all infected patients, including the asymptomatic cases, is on 1%, but it is around 15 to 20% among the hospitalized patients. So we are interested on the Lassa fever, the risk factor for Lassa fever infection, and there are 50 years of Lassa fever infection detected in West Africa, but there are not very good study, especially not very well-designed case control study to identify the risk factors. Many studies was conducted through cross-sectional studies, and they identified risk factor that shows kind of secondary infection, like from human to human infections. But the if we want to prevent the infection, we need to the first infection, I mean, first spillover event. That's why we need to see which route of transmission is very important to get the first human infection in the communities. So the risk factor that we know are like living with someone with a hemorrhagic fever, receiving an injection, being exposed to Lassa fever infected individual, and only one modifiable factors that I have seen is consuming rodent contaminated food. So these risk factors that are related to human transmission further mean that enrolled cases are not the index case, and most risk factors identified through a cross-sectional study, and it raised the ambiguity of temporality of the case as an exposure. So our aim was to identify modifiable risk factor for Lassa fever virus infection in rural Sierra Leone, and we defined a case, and we conducted a case control study in the endemic site of Sierra Leone by enrolling cases and controls. So we defined a case as a person who has been confirmed for Lassa fever virus by either RT-PCR or serology with an illness consistent with the clinical description of the known Lassa fever cases. We defined a control as a person who is living within a 1 kilometer radius area from the identified case house and who had not shown any symptoms compatible with Lassa fever infection in first 3 weeks. First 3 weeks of identification of the case. So we enrolled 1 cases, and for each case we enrolled 4 controls, and sometimes we meet some controls, but our aim was to enroll 4 controls for each case. And we included all the cases between January 2019 to December 2021 and interviewed them between June 21 to January 2022. So we got the data of cases from National Lassa Fever Surveillance Unit at Kenema Hospital, Sierra Leone. So this is our enrolled cases in Kenema district. You can see in the left-hand side is the Kenema district, and the figure in the middle, or map in the middle, shows the cases and controls. So, and in the right-hand side, you can see more details about the controls. Most of the I have zoomed 4 cases, but if you are seeing 3 cases for all of them, 3 controls for each of the controls. In 2 cases, there was controls were missing. In 2 other cases, the coordinates were wrong, so we had to drop them. But ideally, for each cases, we attempt to enroll 4 controls. So we performed data analysis, starting with univariable analysis. And then instead of going to traditional statistical procedures, we developed a causal diagram. As you can see, Lassa fever infection is associated with exposure to rodent and other factors. So we included all the variables that seems to be causal and that are modifiable in our final multivariate regression model. So I'll share some results. So we enrolled 37 cases. Of them, 36 were hospitalized and 23 of them died, with a case fatality rate of 62%. And on average, each deceased person stayed 8.7 days in the hospital, whereas the survivors had to stay 12 days in the hospitals. The mean age of the deceased person was 17 years. The mean age of the survivors were 21 years. Mean age of the overall cases was 19 years, and there was 64% of the cases are female. Of the 140 controls, they all lived in within 1 kilometer radius area, and their mean age was 28 years, and female were 52%. Except for one control respondent, all participants had heard of the name Lassa fever virus. So this is the findings from our study. So you can see there is a difference in the age. So in the cases were younger compared to the controls, and then there are dominance in the female for the cases compared to the controls, and there was a the key variable was presence of rodent, rats or mice in the household. So we asked the question rats or mice, but we found that people are confused to distinguish between rats and mice. So then we combined rat and mice in one question, and we found that almost 83% household in the cases reported that they have seen mice in their household in first 3 weeks, compared to 47% in the controls. And then higher frequency of observing rodents at household, like 2 times versus more than 2 per day. In cases around 72% compared to those 40% of the controls. Also, we wanted to see rodent activity, right? Pups, rodent holes, and in the household, 57% in the cases reported rodent activity compared to the 40% in the controls. There was other variable, but one of the important variable was variable number 7, presence of cats in the household, because cats are advised by the government, Sierra Leone government, and also from many international bodies to control rodents. So we were interested to see whether having a cat is protective for controlling rodent and also Lassa fever. And we have seen that cases has 48% household in the cases had cats, whereas 55% controls had rats in their household. So there was a little difference, but not statistically significant. And also we observed the bushmeat and hunting and all other variables, especially, and also farm juice collection, because that gives more exposure to the rodent. We are using a infrared camera in the household and their storerooms to observe the rodent activities. And you can see the rodent become active at night in the storeroom, especially where they have grains. In the final model, we included all the modifiable variables, age, sex, that were eliminated, and the variables that seems to be biologically plausible are included. And it shows that the presence of rodent in the household in the first 3 weeks increased 11 times risk of having a Lassa fever infection in the household compared to those who did not report any rodent activity in the household. Exposure to wild meat or bush meat increase the risk, but it is not statistically significant. Touching wild animals is significant, increase the risk, but it's still not significant. Having a domestic animals in the household is protective, and having a cats in the household is protective. It seems like it can reduce the infection, but again, it was not statistically significant. So the key findings from our study is that rodent human interaction is likely a key factor for Lassa fever infection in rural Sierra Leone and potentially in other countries in the region, as you can see with a match odds ratio of 11, which is a very high risk for Lassa fever infection. Controlling the rodent population in rural areas endemic to Lassa fever emerged as a critical measures to prevent household level exposure to Lassa fever. And although we did not find having cat is a statistically protective factor, we believe having a cat is associated with lower rodent activity in the premises, as you can see, 73%, 38%. 73 versus 38%, which was statistically significant. But whether having the cat and reporting of Lassa fever that was not significant. Like it was contributed to lower rate of Lassa fever infection, like 48% versus 55%, but it was not statistically significant. In the future, we would suggest to conduct whether presence of cats or having a number of cats in the household reduces household level rodent infestation that is sufficient to control Lassa fever infection in Sierra Leone. So I would like to acknowledge the CTP, who is our donor, all our collaborators, Angela University from Sierra Leone, UCL, FCRM, Chatham House, and African CDC. And my co-authors, especially Daniel, who collected the field data, Javier Guitian, who helped me in the analysis and the planning, and also Francine, Sarah Lee, and Richard Cook, who is supervising overall activities in PANDORA. Finally, Professor Rashid Anshumana, who was the host of all the travels like this. Thank you.
Thank you very much. Thank you very much, Najmul, for your very nice presentation. And I see one hand has been raised. So Isabella.
Hi, really nice study, Najma. I was just wondering, your case fatality rate was really high, and if you've got any explanation to why that might have been, or was it just chance?
No, Isabel, it's probably because we got only because the case fatality rate, there was no asymptomatic cases enrolled in our study. It is because we got the information from a national surveillance unit. So during that time, I don't know, a lot of asymptomatic cases do not go to the healthcare facilities, or mild cases do not go to the healthcare facilities. So this could be one reason. So we only got the registered record of the hospitalized patient, where always you have a high case fatality rate. But at the beginning of my presentation, in the introduction, I have shown that even among the hospitalized patient, the fatality rate is around 25%, but we got a very high percentage. One of the reasons could be we got a lot of cases from the younger population. You can see the mean age was only 17 years. So that could be one reason. But I think Professor Denny is also working on this. He might be able to add up some information with this. Denny, do you want to say anything on this?
Is it on the high fatality, the difference in fatality, or?
Yeah, because we got a very high fatality rate, 62%.
Yes, from past years, the fatality from Sierra Leone has often been higher than other parts of West Africa. That is our observation. I think this may have to do with the serotypes of the virus, the lineage, probably, of the virus circulating in the Mano River Union country, so we think, and probably also due to maybe capacity for managing these cases over the years, so we think, because it's much higher than what we have over here in Nigeria. Over. But I have a question.
Yeah.
Okay.
Yes. Thank you very much, Najmul, for the excellent presentation. I don't know if I had this experience. People think that when you use cat to control Lassa fever in households, sometimes the cats start to die from being infected with the virus. From working with the people, did you get this view, or did you experience something like this?
Yeah. So I think one of the slide here I have shown some activity that these gentlemen are going to collect samples from cats and dogs from the household endemic to Lassa fever, and where there was, from the locations where there was at least one Lassa fever case reported in first 3 years. So we have those samples, and Isobel has analyzed some of them, and we have the question actually whether they have found the cat symptomatic after there was a infected human in the community, not only that their household but also in the communities. If there was any Lassa fever cases, did you observe any illness to your cats? We asked that question. We haven't analyzed those data yet. I have the data. I have collected data from more than 300 respondents, so we will analyze those. But it's a nice suggestion to check.
Thank you.
So